to everyone. Thank you for joining us today from wherever you're from. Okay, next slide, please. Hi, my name is Abigail. I'm from Singapore. I'm a pharmacy technician here in KK Women's and Children's Hospital, and I'll be your moderator for today. Next, please. So we're joined by fabulous speakers from the US and Canada. We have Amanda and Zubin. They'll be talking about to be sharing about the pharmacy technicians and some of the things that they've been doing, and I'm very excited to see what they have prepared for us. This webinar is being recorded and being live streamed via YouTube. The recording will be available on our website on www.advanced.fip.org. You may ask questions using the Q&A. Do not use the chat. You're welcome to provide feedback to webinars@fip.org. You're welcome to become a member of the FIP at dfip.org/membership_registration. Next, please. So we'll be talking about resilience, lessons from the pandemic for post-pandemic world by Zubin Austin. And we have the need to support early career pharmacy technicians by Amanda. We'll wrap it up with Q&A, and then we'll talk a little bit about the other events that are coming up and the conclusion. Next, please. So today's learning objectives will be to understand the characteristics of resiliency among pharmacy technicians, explore evidence-based practices impacting resilience, and develop strategies to support early career pharmacy technicians. Next, please. We have Zubin. He's going to be our first speaker. I'd like to introduce Professor Zubin Austin's research focuses on the professional and personal development of the health workforce. He has published over 250 peer-reviewed manuscripts and is the author of 4 textbooks. He's a fellow of the Canadian Academy of Health Sciences and is the only University of Toronto's professor to ever have received both the President's Teaching Award for Excellence as an educator and the President's Research Impact Award for the global significance of his work. It's a great pleasure to have you as our speaker. Zubin, please. Thank you.
Thank you very much, Abigail, and hello. I am speaking to you today from the traditional lands of the Anishinaabe, the Mississaugas of the Credit, and the Wendat, a place that you may be more familiar with as Toronto in Canada, but a place that has had historical roots and resonance for Indigenous peoples of this land for many, many centuries. Thank you so much for the opportunity to share some of my recent research with you. Much of this research has been supported by the Ontario College of Pharmacists, which is the regulatory body for pharmacy in Ontario, Canada. My research and presentation today is going to be focused on something that maybe most of us would rather forget about, and that is what we've all been through over the last 4 or 5 years. No matter where we are in the world, or no matter where we were 4 years ago, we all know that we are approaching a fairly grim milestone in terms of the day the universe changed for many of us. What lessons have we learned? What can we build on? And what can we do to help ourselves in the future as our world continues to change and where unpredictable events can occur at any moment? That's what we'll focus on today, and in particular, looking at the concept of resilience. Next slide, please, Ines. All of us by now are very familiar with the picture on this slide, the COVID-19 virus. What it did to our world and what it did to many of us as individuals is by now the sort of thing that we all think about, try to forget, or perhaps have learned a little bit from. For me, COVID began in my part of the world on March 13th, 2020. I got an email message from my employer saying, don't come back to work next week. It was a Friday. Take about 1 or 2 weeks worth of work home for you, but after about 1 or 2 weeks, you'll be able to come back into the office. Of course, 2 weeks became 2 months, became 2 years. And over that time, many, many things started to change and evolve, including what we're all benefiting from today, the ability to connect with one another over Zoom. I was one of those people who had the great benefit of being able to work in my basement, work from home, and protect myself from what at that time was an unknown and fairly scary virus. Many of my colleagues and friends and classmates who were community pharmacists and community pharmacy technicians did not have that luxury. While people like me got to hide in our basements and avoid the world and avoid the virus, we had an incredibly important part of our workforce, pharmacists and technicians, who showed up to work every day, went to their stations, and did the best they could under very difficult situations. And in March of 2020, it became clear that this was a very important, strange, and new thing. And as a researcher, it's the sort of thing that I'm very interested. And so my research group immediately set out to understand what was happening. How were pharmacists responding? How were pharmacy technicians coping? What was actually going on in community pharmacy so that we could learn lessons from that for whatever was coming next. Next slide, please, Ines. This study I'll be reporting on today was a case study about real-time adaptation. As the world was changing, as the world was falling apart, as everybody was frightened and uncertain about what was happening, a group of people, pharmacists and technicians, had to keep coming to work and working in community pharmacy practice in Ontario. Next slide, please. Strangely, this is not actually the first time in my career of about 35 years that I've actually had the opportunity or the need to study a major disaster occurring in real time. Those of you who are old enough or were in this part of the world about 25 years ago may remember that there have been other crises that have occurred. And so in 2008, 2007, my research group had actually published this article called Pharmacy Practice in Times of Civil Crisis, the experience of SARS and the blackout in Ontario, Canada. It seems very long ago, but in 2004, there was another infectious disease outbreak in many parts of the world, the sudden acute respiratory syndrome outbreak. It was nowhere near as monumental or global as the COVID-19 pandemic was, but in the parts of the world affected, it was quite major. And that included Toronto, the city that I live in. During this time, hospitals and healthcare centers closed. During this time, community pharmacists once again had to stay at their stations. During this time, pharmacy technicians continued having to provide service and care to the public, while other people got to hide in their basements. A few years after the SARS outbreak, we experienced another major civil crisis, the blackout. Somewhere in Ohio in the United States, there was a branch that fell on an electrical wire. And the fragility of the electrical infrastructure in North America resulted in a massive blackout. Some of the largest cities on the continent, New York City, Chicago, Toronto, Montreal, Washington, D.C., suddenly, for 4 or 5 days, we had no electricity. And once again, pharmacists and pharmacy technicians had to show up to work, do their jobs, and provide care. The idea here is that no matter what is going on, pharmacy is an essential service, and the people that work in pharmacies need to be there and do their jobs. The last paragraph of this paper, perhaps somewhat interestingly, ended by saying it's a good idea to study major disasters as they are occurring in real time because the likelihood of other disasters occurring in the future is high. And what we need to do is learn from each disaster so that we can actually prepare for the next one, whenever that might be. Next slide, please. Little did I know, writing that sentence in 2007, that about 13 years later, in that same journal, I would be writing another paper, this time focused on the experience of pharmacy during COVID-19. Next slide, please. What this study did was explore in real time as it was happening during the first days of the first wave of the COVID-19 pandemic, how pharmacy was coping. This study examined 21 community pharmacists, and the objective was to understand how they were personally adapting and psychologically coping with what was going on around them. People like me were safe and secure working at home, but pharmacists and technicians had to go into the world, be exposed to an unknown virus, and actually continue to do their jobs. How were they coping with that? This was actually the focus of the study. The study took place in Ontario, Canada, and in particular in and around the Greater Toronto area, and took place during the first 3 months of the pandemic, back in March, April, and May of 2020. One of the reasons for this study was to recognize that a second wave was likely to occur, and we needed to learn from the first wave of the pandemic so we could be prepared for the second. This was my first experience using technologically mediated one-on-one interviews. This was actually how I learned how to use the platform we're using today, Zoom. That's how we interviewed people because, of course, even though they were working in the world, we got to interview them electronically. Next slide, please. What we saw from this study is probably no surprise in 2024. In the early days of the pandemic, pharmacies became incredibly busy places. Community pharmacies saw an incredible spike in demand for pharmaceutical products. Everybody was trying to hoard medications. Nobody knew what was going to happen to the supply chain. People were going into pharmacies and stocking up not just on prescription medications, but over-the-counter medications, everything ranging from toilet paper to cough and cold syrups to vitamins and, of course, to medications. This also was happening at a time when across the world we were experiencing a severe disruption of the supply chain. So even though people were hoarding medications and strong demand was occurring, major drug shortages were also occurring, and this was a major problem for community pharmacy staff. In the early days of the pandemic, we didn't know anything about masks, personal protective equipment, social distancing. We didn't know what was going on, and so people were exposed at that time to everything without the protections we know about today. Also, in the early days of the pandemic, there was a lack of access to policy and practice-focused guidance. Nobody was telling pharmacists what they should do. No one was telling pharmacists how they should actually cope with things. No one was giving guidance to pharmacy technicians about how to work within their settings. And so everybody was thinking on their feet and making things up as they were going along. What was clear during the earliest wave of the pandemic is what heroes community pharmacists and community pharmacy technicians were. Because as the rest of the primary care system across the world was shutting down, community pharmacy was the only place open. And this is where everybody needed to go to get anything with respect to their health care. And community pharmacy was becoming progressively overwhelmed. Interestingly, as this was happening, economic issues started to dominate. Because the economy was also closing down, there were concerns about how people were going to get paid, how much money they had to actually take care of their own health. And it was happening when the pharmacists and technicians who were providing care to others were also experiencing major problems at home. Many of them spoke about, well, I have to go to work, but what am I bringing home to my family and to my children? What am I carrying back with me when the rest of the world gets to stay at home? Many of the people who were involved in this study were parents, and as children pivoted to online learning during this time, they were busy trying to help their children cope and figure out how are they going to access their education. And so in the midst of all of this happening in their professional lives, there were significant personal fears and concerns as well. Next slide, please. One of the things that we tried to do was to understand who coped well, who succeeded, and who experienced difficulty, or a lack of resilience during this difficult early wave of COVID. And what we identified was there were 6 factors that predicted individual resilience during the first wave of the pandemic. The first factor was where people worked in pharmacies that actually relied upon technology, where there was email, where there were automated refill systems, where there were possibilities of using Zoom and connecting with patients and other healthcare professionals, where there was technology that helped support individuals' resilience. The next predictor of resilience from our study was that people who worked in pharmacy settings where there was actually guidance made available, where an employer, an organization, a health system provided clear directions. This is what you need to do in the event of drug shortages. This is how you ration PPE. This is what you do when a patient asks you this question. Where there was clear guidance from an employer or an organization or a health system, that enhanced resilience. The third predictive factor was that workplaces that emphasized task focus led to better resilience amongst its staff. Pharmacies are busy places, community pharmacies in particular. At any given moment, pharmacists and technicians are answering telephone calls, stocking inventory, talking to patients, dispensing medications, undertaking medication reviews. That's the way pharmacy has always been. We do a lot of things at the same time. Some workplaces actually changed their approach and allowed individuals, pharmacists or technicians, to focus on a single job at a single time. And where we shifted to a task focus from a multitask focus, that enhanced psychological well-being and resilience. The fourth factor was where pharmacies shifted their traditional scheduling methods. Typically, we would schedule individuals to work for 8 or 12 hours in a pharmacy. But early on in the pandemic, what some employers actually did was realize we need to minimize risk of transmission. So instead of scheduling a single individual for a single shift, we're going to schedule entire teams at one time. So you end up working with the same people over and over again. And where you work with the same people over and over again, that breeds familiarity, that breeds interest, and people could look out for one another. And these were the places where resilience was improved. The fifth factor was where pharmacies actually provided dedicated non-professional specialty staff focused on things like security and wayfinding. Early in the pandemic, there were limits on how many people could enter a pharmacy as a way of trying to minimize transmission. People had to stand outside and wait in line for their time to come so they could enter the actual physical premises of a pharmacy. And in some cases, it was actually the technician or the pharmacist that had to do that job. And where actually employers hired people specifically to do jobs like that, that became a place where people had better psychological well-being and resilience. Interestingly, in some cases, some employers actually arranged to have coffee and lunch brought in for the staff. In this day and age, in my part of the world, it seems everybody has forgotten how to make a sandwich and bring it to work for lunch, even if you're just eating while you're standing and working. But in a time when all of the restaurants and cafes and coffee shops were closed, nobody had food or coffee at work. And so some employers figured out ways of bringing things like that into the workplace, and those were the places where better resilience was seen. Finally, workplaces where employers provided PPE, personal protective equipment, to help protect the staff, these were places where individual resilience was improved. As you reflect and hear what this study showed predicted resilience, one thing I hope becomes clear. In the past, we have always thought about psychological well-being and resilience as a personal issue. Are you feeling stressed at work? Are you burning out? Are you experiencing psychological problems? You should do yoga. You should go jogging. You should meditate. The idea being that if you are being overwhelmed by your workplace, something is wrong with you and you need to actually fix it for yourself. This study, for the first time in the pharmacy profession, actually highlighted that what predicts resilience is not personality. It is not individual characteristics. Instead, all of these factors that predicted resilience were management decisions, were business choices, were things that employers, workplaces, and health systems could do. Next slide, please. What this points to is the concept of something called system resilience. Of course, it is important that we all take care of our own mental health and well-being. But what this study suggested is even the most psychologically strong and resilient human beings would be crushed by an unexpected event like COVID-19. Nobody is strong enough to withstand events like a pandemic. Instead, it is really up to employers and workplaces to provide the supports that individuals who work there need in order to stay strong. For a generation, then, we have had it backwards. In pharmacy and other healthcare professions, we have recognized that there is stress, there is burnout, there is excessive workload. And the way we have advised people to manage it is by going jogging, to meditate, to go for therapy. We have treated occupational stress and burnout like it is a personal defect or a personal problem. But what this study said is that it's much more simple than that. Instead, employers need to make choices to create safe and effective working environments. And when they protect their staff, then that staff has the strength to serve the patients that need them. Next slide, please. What then is the role and value of personal resilience in an unresilient workplace? If you have the bad fortune of working in a place that is not as concerned about mental health and well-being as it should be, of course, personal resilience is important. If you've been on an airplane recently, you know that when you are given a safety briefing before takeoff, they will always tell you in the event of a plane crash, oxygen masks will drop and you need to put oxygen on yourself first before you help the person beside you. Of course, when a plane is crashing, you have to put oxygen on yourself first. But what system resilience tries to do is develop ways of ensuring the plane does not crash in the first place. If we build strong system resilient pharmacies, then the technicians and the pharmacists that work in them will be at their best and can help their patients. Next slide, please. What this study actually highlighted, and is I think a very important thing to consider, is that you and I are much better off and an advantageous situation if we are unresilient people who have the good luck of working in a resilient workplace. What it also means is you might be the psychologically strongest and most resilient person out there. But if your workplace doesn't support you and your workplace is not system resilient, you will not be able to withstand it. What this then means for pharmacy and pharmacy technicians is that we now need to really think about workplaces. We need to work with employers. We need to work with unions. We need to work with health systems and large organizations and start to think about how we can learn from the pandemic and create workplaces that are better resilient, can adapt to unexpected events like a pandemic, and then can actually support the workers who are there who need to provide care to patients. Next slide, please. If you're interested in reading any more about this, there are a couple of references here. I'll turn it back to Abigail, and I look forward to any questions or discussion that we can have after this. Thank you so much for attending today.
Thank you, Zubin. That was a interesting and insightful presentation about resiliency, and I think I'm looking forward to the kind of questions that's going to come up. And as next, please, we have our next speaker, Amanda Canas, sorry. Dr. Mendes is board-certified pediatric pharmacy specialist in hematology oncology at Children's Hospital at the King's Daughters in Norfolk, VA. She completed her PGY1 residency at CHKD and a PGY2 at Children's National Medical Center in Washington, D.C. Amanda started her pharmacy career as a pharmacy technician for Kroger Pharmacy prior to working as a student pharmacist, intern, and staff pharmacist. She has served a variety of leadership roles in the regional, national, and international level. She served as FIP as the Early Career Pharmaceutical Group Chairperson in projects in 2022 and 23. She's currently the ECPG Professional Development Coordinator. Thank you very much, Amanda. The floor is yours.
Good morning, good afternoon, and good evening to everyone today, and thank you so much for having me here today. So I'd like to talk to you a little bit about mentorship and sort of switch our focus for just a little bit about why mentorship is necessary for resilience. So first, I'd like to talk about how I got to where I am today as a clinical pharmacy specialist. And honestly, it was through really great mentors. So I started out my career as a pharmacy technician at Kroger Pharmacy, which is a community pharmacy here in the United States, and had very great mentors that maybe I didn't realize at the time were mentoring me, but they were people that I looked up to in the workplace and thought, that's the kind of technician that I want to be, or those are the skills that I want to have. And so throughout my time as a pharmacy technician, I started to think, how could I advance my career in pharmacy? Maybe I want to take this further. So I took their lead and I took the pharmacy technician certification test and became a certified pharmacy tech. The relationships and the skills that I was gaining and building with my patients led me to think that I think I want to go to pharmacy school. And so I went to pharmacy school, and during that time, I worked as a pharmacist intern. And so still building on those skills and still looking up to that the pharmacy technician, then I sort of gained a pharmacist mentor. And so these mentors started to add on to each other and bring me different skills that I could learn from different perspectives. From there, as a community pharmacist, still at Kroger, I began to look to, district pharmacists and other people who had been with the company for a long time and think, this is the kind of leader that I want to be, and this is how I want to lead my pharmacy technicians. And also, still referring back to that initial pharmacy technician mentor. What can I do to support you? What can I do to make your job better? How can we help each other? And so each mentor along the way gave me different skills and a different perspective. Then I transitioned into pharmacy residency and switched over to hospital pharmacy. And so here, those mentors sort of changed. I still keep in touch with my community pharmacy mentors because I think it's important on the hospital side for me to understand when my patients leave the hospital, what are the challenges that they may face in getting their medications? Or if I call a pharmacy and I'm speaking with a technician, what are the things that they're doing? How can I relate to them? And so I continued to keep those things in place, but now also, again, building onto that with mentors who were clinical pharmacy specialists, who were older chief residents, and who was going to teach me, how to be a preceptor or how to be that clinical specialist. So at each step along the way, I just continued to gain those mentors. And then finally, as a clinical pharmacist specialist, my mentors have really taught me to do things like how to balance my role as a clinical pharmacy specialist while also doing things like leadership roles, precepting, teaching. And so all of these mentors are still very important. Do I still have formal mentoring roles with all of them? Not necessarily, but I do think that's important, to keep your connections and to keep those skills that you've learned throughout your career. And that at every step, mentoring is important and brings a new perspective to you. So now I just want to give you a brief, non-scientific, real-life glimpse at a single institution about what pharmacy technicians in a hospital setting think about mentoring. So I asked several technicians, do you have a mentor? And pretty much across the board got that yes, people felt that they had personal and professional mentors. What I did find that was that most felt that their professional mentors were most commonly in their current workplace. So not part of a larger organization, or their past workplace necessarily, but their current mentor was also in their current workplace, which I thought was interesting. Everyone unanimously said that they felt that mentoring was important. When I asked, what did you learn from your mentor or why you think it's important? They said advice when changing jobs or negotiating, or understanding the role or the why behind the processes that we do. This ties in with what Zubin mentioned previously, that those with the most resilience had clear guidance and were task focused. So I thought that was an interesting tie in there. And finally, I asked about mentoring being formal or informal. Everyone said that they thought it should be both, that they were more likely to be open and honest in an informal setting. And while they mentioned that formal and informal were important, no one really gave me an example of formal mentoring that they were participating in. So I think that's something that can be explored further. So now I'm going to switch gears again and talk a little bit about the Early Career Pharmaceutical Group, ECPG, and their mentorship program development, to provide maybe some ideas or feedback into something that is a more formal mentoring program, how to start that, and challenges and successes. So the Early Career Pharmaceutical Group, formerly known as the Young Pharmacist Group, the name was changed in 2022 to better reflect our membership. So everyone in our group is not necessarily young. We're just early in our career. Maybe you've had a career change, you came to pharmacy later. And so we felt that the young should be replaced. Also, it's not just pharmacists, it's anyone in the pharmacy industry, pharmaceutical scientists, academia, pharmacy practice. So anyone encompassing the pharmaceutical membership of FIP who is within the first 8 years of their primary pharmacy degree. Our core activities focus on personal and professional growth, capacity building, and leadership development. And we do that through programs such as the Remote Volunteer Program, the Mentorship Program, our Leadership Development Program 2.0, and professional development resources offered by ECPG. So in 2019, when the group was still known as YPG, a member needs assessment was carried out and sent out to all of our members. And the top reasons that people gave for joining YPG were networking and professional development. And of professional development, the number one reason was mentorship. So YPG, now ECPG, relaunched the program in September 2020 with 12 mentees in our new mentorship program. We utilized interested FIP members as mentors. So our program workflow is that a mentee is matched with a mentor based on interest area. For example, if you were interested in the industrial pharmaceutical area, we would match you with someone who is an expert in that area. The group would then develop an individualized mentorship plan, so determining what you would like to work on throughout the year, where you thought you needed to grow, and what your goals were. We held an orientation session for our mentees, and then we had every other month catch-up sessions. And these times provided networking for the mentees, time to talk about things that were going well or not going well, and really just to discuss the program and to spend time with one another. Finally, we had a final program evaluation that was completed by the mentor and the mentee, and then feedback was provided to the mentor and mentee based on those evaluations. So the program feedback that we received after following this model for about 3 years was that there was a desire for more networking time with the mentees and the mentors. So our mentees had time to spend time together. There was a WhatsApp group, but really they wanted to try to network and communicate with the mentees and the mentors. And this desire came from both groups, the mentees and the mentors. Even the mentors did desire to learn from other mentors. So the way that we addressed this was by aiming for smaller groups and having more meeting options for a variety of time zones. As I know, there are people from all around the world on this call. It's the middle of the night for some of you, it's early morning for some of you. And so you understand how that could be very difficult. Um, Secondly, our participants needed mentors with time to invest in the program. So previously, we had very experienced, very involved mentors and people that held numerous roles within FIP. This was sort of a double-edged sword because it was really great for our mentees to be able to work with these people, to learn about FIP, to learn about their area of interest. But at the same time, it did somewhat limit the amount of time that mentors were able to spend with their mentees. So we tried to address this with an expanded mentor pool. We used our ECPG liaisons that are implanted in every section in SIG to reach out to members of their groups to see who would be interested in being a mentor and try to bring in new volunteers. Secondly, we also considered utilizing experienced ECPG members, so those who were closer to the end of their time in ECPG, who had also previously completed the mentorship program, being able to move from that mentee role over into a mentor to also allow us to further extend the mentor pool. So how did we do this? So for the 2023 cohort, we had 5 mentor and mentee pairs in our current group, which is much smaller than what we had previously. The mentor pool, like I mentioned, we utilized ECPG liaisons, and we were able to recruit all new mentors to the program, which was very exciting. These are still very experienced mentors who are very passionate for teaching, but they had never been involved in the mentorship program and had less responsibilities within FIP. And finally, compatibility. So we introduced the mentees to multiple potential mentors. And the final match was then determined by the mentee. So they were able to set up Zoom meetings, discuss their mentor plan, their goals, their interests with 2 to 3 potential mentors. And then from that group, the mentee was able to determine, I think I want to match with this person. I feel like our compatibility is the best and that we would be the best pair for the year. So all these things we did to try to make sure that the mentoring was more successful throughout the year. And this current cohort is still ongoing. Challenges to the ECPG mentorship program, and really any mentorship program. We had a closed meeting at the FIP Congress discussing mentorship and struggles with programs, and had leaders from different mentoring programs that were there with us. And many of us experienced these same struggles. So finding a wider mentor pool. Very frequently in professional organizations, you have the same small percentage of people filling the number of roles, which can make it difficult when you're looking for something that needs as much time as something like formal mentoring. Secondly, are there too many options? We found that many participants were trying to do multiple leadership and mentoring programs at the same time, or be mentored in multiple formal programs, which then also stretched the mentees too thin. Again, time zones, it was very difficult to group all of our mentors and mentees into the same time zones and find meeting times that were available for all of the mentors and mentees to be able to meet together. Also, anytime that you have a program that is being run by humans and completely, participated in by humans, it's going to be a challenge to keep everyone engaged to make sure that the program continues to run smoothly and that there's a smooth handoff year after year. And then finally, what we've seen in many organizations, and not just in the mentorship program, but in general organizations overall, is just apathy. Over the last several years, everyone is, very tired of digital meetings and, online time together hearing about things like resiliency and burnout and leadership development, skill building, sort of those kind of things. And so people just sort of want a break. And so finding people that want to participate also can be difficult. So these are just some of the challenges that we've experienced with ECPG, and that you may experience when trying to participate or trying to start a mentorship program. So I look forward to your questions. Thank you for having me today. And I hope that you all understand the importance of mentors. When speaking with my technicians, I learned a lot from them as well about, why it's important, even as a pharmacist, to have technician mentors, as a technician, having pharmacist mentors, and those at mutual relationships and how they can benefit. So I look forward to our discussion now. Thank you very much.
Hi, Amanda. Thank you for the presentation.
Thank you.
It was really insightful. Let's see what kind of questions we have. We have a question for Zubin. You talked about the role that management and businesses play in resilience. What role, if any, does the pharmacy regulator play in contributing to resilience for pharmacy professionals?
That's a great question. Thank you very much for asking it. I think what we are seeing around the globe is the recognition that pharmacy regulators are part of the system. And if we have system resilience, we will need regulators to be involved. In many places, pharmacy regulators not only regulate human beings, they regulate places of business, like pharmacies, community pharmacies. In other parts of the world, there are other kinds of regulators that deal with hospital pharmacy settings. In many industries, there are regulatory requirements around workload, around mandated breaks, around number of hours that you're allowed to work. I'm sure many of us have been on airplane flights where at a certain point someone says, I'm sorry, the flight is going to be delayed. The crew has exceeded the number of hours they're allowed to fly safely, and another crew has to be brought in. Pharmacy regulators in many jurisdictions have opportunities to explore whether those kinds of regulations can contribute to system resilience, and I hope that they do. But this is going to require the whole pharmacy community and all pharmacy professionals to work very closely and productively with regulators in order to give them the data they need in order to be able to act in that way. Thank you for the question.
How do you guys think that resiliency and mentorship could go hand in hand? This would be for both of you. I think it would be a great
Amanda, would you
topic
like
of
to start?
discussion. Yeah.
Sure. Yeah. I think resiliency can be learned. And also, like Zubin was saying, it comes from management. And so, coming from the top down is very important. And if you have those mentors, you're able to work together with them, and really develop the skills that are needed for resilience. But again, I don't, like Zubin said, it's not a personal thing. It's not that, I'm sure many of you have seen the meme about, the plant dying, and it's like, well, did you not take care of the plant, or was the plant just not strong enough to handle the environment? And so, resiliency shouldn't be viewed that way. It should be, who do you have to support you? And so I think mentors are very important in the supporting role of resilience as well.
Yep. I couldn't agree more with you, Amanda. As your presentation really nicely pointed out, mentorship is almost like it's like a vaccination. It's an inoculation. It's a relatively small and early intervention in somebody's life that can have enormous positive benefits throughout the rest of their career. The relationships that are at the foundation of mentorship are in and of themselves really psychologically powerful. But when you have mentors, especially mentors who are more senior, who are perhaps in a position of power or authority, they can learn from the people they're mentoring in order to help create the safe and resilient systems that everybody needs. And so mentorship is not just a one-way street, it is a two-way street. Mentors learn as much from the people they mentor as as the other way around. I think actually mentorship is probably one of the single most important kinds of system resilient features that we haven't yet, I think, in the pharmacy professions really figured out how to make the most of it. And so I hope the work that Amanda and others are doing in this space really starts to become much more prominent.
Yeah, and if I could just add quickly, when I was asking my technicians here at the hospital about mentorship, and I asked one of them, "Do you think that mentoring from pharmacists here is valuable to you? Do you see that as helpful?" And she said, "Yeah, absolutely. We're learning and seeing what you guys are doing all day, every day, and knowing that what you're doing is, that there's a patient behind that, and the reason for why you're doing those things helps us make our job more clear. We understand more why we need to do the things that we're doing. And so, you don't have to want to be a pharmacist when you grow up to have that pharmacist mentor. And, we can, like you said, we can learn from each other. And so, having that relationship helps me understand the technician processes and how I need to communicate things with them and things I need to explain to them so that the patient gets the best care. So, yeah, definitely a two-way street. I agree with that.
Thank you both. I don't think we've got any more questions. It must have been a really informative, presentation from both of you. It was just really, really clear on the points that was being brought across, and I thank you both very much. Thank you everyone for joining us. Ines, if you could bring up the last few slides, maybe we could talk about the upcoming events. Thank you. So please visit fip.events.org for future if webinars, as well as to keep in mind that the abstract is up and open for this year's FIP conference in South Africa, in Cape Town. So I hope to see everyone there. I'm not going there, but my friend is. But yeah. So do keep in mind of the dates. Abstract submissions deadline is on the 15th of March. The announcement would be on the 15th of April. Early bird registration deadline is on the 31st of May. More information at capetown2024.fip.org. Thank you everyone for joining us. I hope you guys have learned something from this. And good morning, good night.